Senate Majority Leader Andrea Stewart-Cousins, so nice to talk to you again.
It's always good to speak with you, Karen.
Now, as we're speaking, you're going to have a few days of the legislature meeting. You're already at the Capitol. You're going to go into session. Is this
That's
it for 2020? Are you going to be gone after this week for good?
No, Karen, it's not going to be like that at all. Our reality is that there is nothing normal about this session. Our session technically ended on June 2nd, and obviously it has not. And it hasn't because there's still a lot to be done. And we are wanting to be as nimble as possible to continue the work that people of New York expect us to do. So we are doing a lot in order to continue to make sure that New York is working, that it's working well. And of course, we are still, having hearings and expect to come back as the budget unfolds and, on the congressional level.
Yeah, well, we'll get to the budget in a moment. We reporters have been hearing a lot from advocacy groups with a lot of measures. One is called the Cancel Rent movement, which would suspend rent payments until the pandemic's over. Others think the wealthy should be taxed. Wondering if any of those issues are going to be addressed this week.
Well, we are, obviously very proud of what we have done in terms of tenant protection and rent, and we are as concerned as everyone and how this is going to unfold. But the reality is that we are still doing things. We've passed legislation, as you know. It just started last week, the Emergency Rent Relief Act, where our lowest income New Yorkers can get subsidies for their rent so that no one will be evicted. Obviously, there's an eviction moratorium. We also have legislation that stops utilities from cutting off their gas and electricity and telephone. So we are continuing to work with New Yorkers to keep them in their homes and try and figure out a path forward.
Do you think do you think that what you're doing and that is enough? Because it does seem like there's a terrible housing crisis looming if things don't get better soon.
There is a terrible housing crisis, and we are trying to figure out every way possible to make sure that New Yorkers we're all suffering. We are all suffering. So we want people to stay in their homes, and we're trying to figure out ways to make sure that happens. We have the reality of the resources, and we need federal help. We need federal help in terms of housing because this is happening all over the country, and unless we get federal help, we will not be able to help New Yorkers in the way that we know they need to be helped.
Well, the elephant in the room, of course, is the state budget deficit. At last count, I think it's about $13 billion, if not more. Governor Cuomo is threatening to make 20% cuts to schools, local governments, healthcare if the feds don't act. So I guess I can take it that you won't be acting on the budget this week. I know that you're waiting for the federal government to act, but it just seems like time's running out. They've got to act soon. And what happens if they don't give enough aid?
Well, I understand that they are acting. I want to obviously, from the last go round when we were trying to do the budget, Senator Schumer was extremely helpful, as was Senator Gillibrand, in making sure that state and local governments got the resources to at least stave off some of the worst that could happen. Now, our congressional delegation has advanced what they call the HEROES Act, which would be extraordinarily helpful for all of us in all of these categories.
Right, that's what the Democrats want, right? But the Republicans in the Senate have to go along with it.
They have to go along with it, and from what I gather, there is some conversation now because as COVID rages throughout the nation, everybody, I think, is being hit one way or another with the incredible expense in every way of COVID-19. So I understand that the Senate is beginning to talk. Obviously, it may not be what the House has put forward, but the dire need for all of us, especially here in New York, we were so very, very hard hit, has got to be topmost in everyone's mind. So we expect we'll be back. We expect we'll have to deal with, our issues, but it will be a lot easier to deal with if we have some real help from our federal partners.
Right. Back in March, the legislature granted Governor Cuomo a number of extraordinary powers, and he's used them to shut down schools, shut down businesses, make everybody wear masks. I'm wondering, looking back, if there's any powers that you regret giving him or if the legislature went too far.
No, I think you remember, as we all do, those days in March where all of a sudden we were hit and we acted extremely quickly under the circumstances, and we understood we had to be nimble. And, I think that, the governor has done an extraordinary job with making sure that we're in this place now where people are looking to us and to the things that we did, and all the things you said, wearing a mask, shutting down, so on and so, we did. So no, I think New Yorkers agree that the governor has handled the powers extraordinarily well. We are not done with this pandemic. I think, as you and I were speaking even before we got to share with the audience, the fact that the nation is on various stages of the virus or shutdown or fighting about masks, and we are a very small country. And so at any given time, although we're doing well, if we lose our guard, if we let our guard down, we could be in trouble again. So I don't think that's our issue now. I think our issue is staying safe and trying to build on what we've gotten.
And finally, looking ahead to August, the Senate and Assembly are going to have hearings on the nursing homes. What, if anything, went wrong? As you know, over 6,000 residents died. There was a controversial March 25th directive by Governor Cuomo that said nursing homes had to take back residents who were COVID positive. What do you hope to learn from the nursing home hearings?
Well, we're going to look at, and I will say that that's going to be one of so many different hearings because COVID impacted every piece of our lives. But we're going to be looking at the mortality rates. We're going to be, looking to see what we should learn from what's happened and how, should anything like this threaten us again, we will be prepared. What do we need to know? What do we need to learn? And obviously, I think those hearings, all of them, will give us a great deal of insight as to how we performed and what we might do going forward.
So do you view that in any way as an adversarial hearing
No.
with the governor's people? Because I know your Senate Health Committee chair has been a bit critical of some of the ways the nursing homes were handled.
I like to take hearings for what they are, which are hearings. We ask questions, we get the appropriate people around the table who will give us testimony and insight. And like I said, what we want to do is, to do our jobs and to do them as well as possible. And we want to learn from whatever we can learn from and make sure that we are poised to take care of anything like this going forward. And like I said, there were so many things to learn. And so this is an opportunity. It's a hearing, and we will be listening.
All right, well, we'll have to leave it there. I'm sure a lot of people will be tuning into those hearings. Thanks very much for giving us your time. I hope that we'll talk again soon.
I hope so. Thank you.